My name is Karen Hill, and I'm in Vancouver. Today is the 7th of April, 1984. This is the Oral History of Social Work in Canada project, a project of the Canadian Association of Social Workers. Today I'm interviewing Miss Eleanor Bradley, who's had long experience in social work in British Columbia. Miss Bradley, in order to get started, I wonder if you might tell us when and who you are and when and where you were born.
I'm Eleanor Bradley, and I was born in New Brunswick. And in 1928, our family moved to Vancouver. And I had completed high school, and that was the beginning of the Depression. And I went to business college, and then worked for several years. And in 1933, I went to the Royal Jubilee Hospital in Victoria, trained as a nurse, and graduated from there in 1936.
What was it like in the Depression in Victoria?
Well, I think it was pretty much the same as other places. I think in the hospital we were so involved in our own work that in all the complexities of training that we weren't too aware of what was going on, except for the people who came, who were really in very dire circumstances, some of them.
Mm-hmm. You trained as a nurse at the hospital. Were there social workers there at that time?
Not at that time, no.
Mm-hmm. So what happened as you continued to work as a nurse, did you?
Well, after I finished training, I worked in private duty for a year and a half. And in the spring of 1938, I was approached by the director of the Children's Aid Society in Vancouver as to whether I would go on their staff as a nurse, which I did.
Mm-hmm.
And by the fall, I had become more interested in the social work aspect and started taking courses at UBC and worked toward my diploma, which I completed in 1944, which was working and studying at the same time.
Mm-hmm. What was it that intrigued you about what the social workers were doing at Children's Aid?
Well, I think just to go back a bit, in nursing, I felt there was a lot more to know about people and the understanding of people, which I felt was not touched upon at all in nursing at that time. I think it has changed since. And I became very interested in a lot of the patients and some of the social conditions in which they lived. And I think another thing that affected me, I wasn't too enamored with the hierarchy in nursing. And so when I had the opportunity to change and learn more about social work and have the opportunity to gain more about people and social conditions, that was, I felt, was where I wanted to go. And
Mm-hmm.
I did.
When you began taking courses here at the University of British Columbia, what kinds of courses were available then for you?
Well, there were basic courses in casework and in a lot of the legislation, and we had Dr. Topping, of course, for many of our courses, and then we did field work as well. I had to take 2 months off and do field work, and then one summer you had to do an advanced course in casework. And I was very fortunate that summer. We had Florence Day, who later became the director of the School for Social Work at Smith College.
Mm-hmm. Where did you do your field placement at?
My field placement was done at the family, what was called then the Family Welfare Bureau. And I had Miss Elizabeth Grubb as the supervisor, and Mary McFedrin was the director at that time.
Mm-hmm. What was the work of that agency at the time?
Well, it was offering services to families and really trying to help them with their many problems.
Mm-hmm. Did you, what kind of change did you see from the nursing work that you had been doing to the work that you were doing in that field placement?
Oh, well, as far as the nursing was concerned, you know, you were offering physical help primarily to patients, where I think in the social work you were looking at more the total person and helping them.
Mm-hmm. Mm-hmm. The war broke out during the time that you were both working as a nurse and being a student. What impact did that have on you?
Well, the impact that in working at the Children's Aid during the war was I was doing adoptions at that time. And of course, when the war came along, there were all the stepfather situations. You found that in order to get an allowance for the child, my stepfather had to legally adopt the child. They couldn't get the allowance unless the child was adopted.
Mm-hmm.
So it meant overnight, we practically had hundreds of applications. And I can recall many evening meetings with people and interviews to complete these applications because they all wanted them, today, so to speak.
Mm-hmm. Mm-hmm.
So that was one of the things. And then also at the Family Welfare Bureau, which I wasn't directly involved in when I was doing placement, there were a lot of similar situations that the workers were involved in.
Mm-hmm. You mentioned that you were doing adoptions at the Children's Aid. Were your nursing skills called upon in that position at CIS?
Well, in doing social work, I'm sure the things that I learned and in training helped me a great deal, but I never felt, and I felt there were two different professions. I was not a nurse when I was doing those sort of adoptions or foster home supervision or with students and so on. I felt I tried to separate the two, and I think I successfully did that.
Mm-hmm. The reason I inquired about that was because I understood you say that CIS had hired you as a nurse.
Well, I started first as a nurse and supervising infants in the foster homes. And then I quickly moved to, with a social work focus in supervising children, older children in foster homes and placing children.
Mm-hmm. Was there, what kind of caseload was there during the war with adoptions? You mentioned that there was an increase in the number of stepfathers and the adoptions that way. Was there a change in the child protection caseload too?
Yes, I think so. In the whole, the more children in care. I can't recall the numbers at this point, but it was a very, very busy place. And another factor was that we had children, the overseas children, you know about the children who were brought from Britain to be taken away from the bombing and were placed in foster homes throughout Canada. Well, we were involved in that, and that was another very heavy caseload. Because you had to do a study of the foster home in which the children were placed before they were placed, of course, and then the follow-up after.
When the British children came over, were they placed immediately into foster homes?
Yes, yes, pretty well.
So there was, you didn't have to have any kind of a holding facility or anything?
Not a large one. Some of them may have gone for, a period, a few days, but my recollection is that they pretty much went directly to foster homes.
What happened, Miss Bradley, when those children, when the war was over?
Well, I think some of them went back home, and some of them stayed in Canada and were settled.
Were you dealing with those children at that time?
No, I was not. I think I left the Children's Aid by then.
Oh, I see. Another question that I wanted to ask about the Children's Aid Society during that period of time was about adoptions. In some provinces, there was a great difficulty finding adoption homes, and children were placed in other provinces or other countries. Was that ever experienced here?
No, when I was in adoptions, we had many, many homes. We had a waiting list for children to be placed. Wanting children.
Also, the Children's Aid Society at that time, I'm wondering to what extent the government was involved in the Children's Aid Society activities at that time.
Well, at that time, it was strictly a private agency, and with the board, and the government. Of course, there were some funds for some children in care, but on the whole, it was a private agency. The board.
did you have many Indian children during the time that you were
We
there?
had some, and when I joined the Children's Aid, they had just been through a situation of placing children of the Doukhobor, the women that had been put in prison, and there were these children that were looked after. I wasn't involved in that, but we heard stories about that. That was another example of what the Children's Aid were doing at that time, and an impact on the agency where they had and we had a number of Indian children, and they weren't easy to place.
Why is that?
Well, I think they had difficulty in adjusting to the different type of living. And I think we tried to impose what our standards on them, which was not easy.
Another question about the CAS. What area did the Children's Aid Society cover at that time?
At that time, the Greater Vancouver. We had Richmond, we had foster homes in Richmond, Burnaby, and the North Shore.
And were you the only child welfare agency in town at the time?
No, there was the Catholic Children's Aid, which was also very active, and just the two agencies.
Okay. You were at the Children's Aid Society until
1947, I left, and I was asked to go to the Vancouver General Hospital to the Social Service Department. Up to that time, the department had been, the director was a nurse, doing a very excellent job in the hospital. I think the time had come, they felt that they wanted a professional department. And I was there for some time as supervisor and acting director of the department.
And did you have other staff?
Oh yes, the staff increased. When I left, we had about 10 or 12 workers in the hospital.
How was the profession of social work accepted in the hospital during the time you were there?
Well, it was a slow uphill job because I think, again, as the history of social work in hospitals, the social worker did many of the practical things and for patients rather than getting into and helping them with their social emotional problems or their attitudes, feelings toward illness. And that was the new added component at that time.
What were the practical kinds of things that social workers would do?
Oh, they would get taxis for people. They'd find, which I think some of them are very legitimate and very proper, but finding placement for them, finding them a suit of clothes, these sorts of things. And much of what as I say, the feelings and attitudes or the social conditions into which the person was going back that was rather limited.
And how did that change over the years?
Well, it did, and as it changed with the addition of social workers with training, with professional training, and social workers who would be persistent and capable of working with doctors, nurses, other professionals in seeing that there was an added component that you could. And the other thing I think that was so important that helped in that particular setting, the School for Social Work used it as a student placement, and we had excellent students. And I remember one year I had 6 in their second year in the master's program, and with that background and their capabilities, I think we were able to demonstrate a great deal, which meant in one particular instance, I remember a social worker being assigned to a particular service because of the a demonstration that she had performed.
So she was assigned to the medical
This was
service.
a neurological ward, and there was a social worker assigned to that ward for some time. Social worker assigned to psychiatric services. It was an uphill, and you consistently had to help be on your toes and demonstrate what you could do.
So there was a feeling of being sort of tested or
Oh, yes,
looked over
yes.
all the time?
Until the doctors and the other staff and the nursing staff was very important to make a contact there.
Mm-hmm.
So that was that was an exciting part of it.
Mm-hmm.
Right.
Mm-hmm. How long were you at Vancouver General?
I was there from 47 to 52 when I was asked to go to the Canadian Arthritis Society, the BC division here, and set up a social service department there. They had just started the society in British Columbia, and they had developed an inpatient program as well as an outpatient program, which is the G.F. Strong Rehabilitation Center in that particular building. And so that was another experience, and a very good one, because the doctors were very interested in patients and very aware of the emotional component of the rheumatic diseases. And so we got that one going.
Was that a government organization?
No, it was a private organization with a board.
Did you have relationships with the board that were part of your
Yes,
job?
we did. We were able to discuss with the board some of our plans that we wanted, the ideas of how we were helping people. And the annual board meeting, the social service workers were asked to present cases and to present their plans and what they've been doing. Yes, there was a very close working relationship in that small agency. It was very good. And now they've grown and they have a number. I don't know how many social workers they have now. But that was, I think, a demonstration program again where another member of the health professionals could assist.
Were the social worker as another health professional, do you mean?
Yes, in the team of physiotherapists, occupational therapists, nurses and doctors, and the lay staff as well. We had a lot of volunteers, and they were included in the discussions and planning for patients as well as the patient and his family.
So you had at that agency a team approach to
Yes,
dealing with
that's
it.
right.
Were you working at all with the families of the person who was? in the
Yes,
center?
we did. And when the family, many of these patients came from outside of Vancouver, and when they did, we made the contact with the social worker in their area. For instance, if they came from Victoria, why we'd communicate with the appropriate agency there. So there could be work with the family and with the patient as well.
And did you maintain the contact that you'd had with the school?
Arthritis Society?
Yeah.
Oh, yes, I had students there. We always had students. Seemed to be, and enjoyed them. And it was a good demonstration because we had students from other professions as well.
What kinds of other students would you have?
Well, like from the school, from nursing, and from when they established the school of physiotherapy and occupational therapy here, we had students from those schools as well.
At that agency, were there the questions about the place of the social worker in the team?
Oh, yes, oh, yes. There were a lot of questions, and you had to be, was a continuous education and demonstration to other professions as to what you could do. And of helping them see that maybe a patient wasn't ready for a discharge out into the community, that they needed, for these reasons, a longer period. And usually your professional assessment was understood and accepted, which was the nice part about it.
It had not always been that way?
Well, it wasn't always that way. Like, for instance, if you went back into the general hospital, why, you didn't always have that impact or that much of a listening to by other professions sometimes.
Were the questions that were asked, and I don't know, maybe perhaps you could tell us to what extent they were articulated questions or whether they were questions that were under the surface, were the questions about what you could do or were they about whether or not you could do what you said?
Well, I think it was both, as to what you could do. How, you know, they would question you, now how are you going to do this? Or if it was a matter of a problem in relationships in the home, or the acceptance of, say, by the wife of her husband's disability. They would say, well now, you know, how are you going to do that? Well, you'd have to discuss and say, well, we want more time to talk about it and try to help them accept each other's role or their position. And it was a continuous planning and discussing with them and a demonstration. Because if you could, and the caseworker could work with that family, and then they could see the change and the change in attitudes, why then when the next situation came along, well, they'd say, well, now how about you working on that?
So you were able to get some business for yourself.
Yes.
Yeah.
And while I was at the Arthritis Society, I had 18 months off and went to the Smith College School for Social Work and did the master's program there.
How did it happen that you chose Smith?
Well, I knew Miss Day, Florence Day, from having been here from the earlier years of taking the advanced casework from her. And I looked around at the various schools and also where they gave placements, because I went wanting a placement in a medical setting where there was good psychiatric consultation. And of course I had the dream that the Boston, or the Massachusetts General Hospital in Boston was the place I wanted to go. So that was another factor that made my decision. And I talked with other social workers who had gone away and had taken their master's program. And we had Marjorie Smith at the School of Social Work here at that time. And in discussions with her, she thought Smith would be a good spot for me too. So there were all these sorts of factors.
Was there, with Smith being in the United States, and of course you being Canadian and practicing in Canada, was there much difference between, was there anything distinctly American about what you were learning that would have been harder to apply here in Canada?
No, I don't think so, because I went having, I think, practiced in social work on perhaps using good common sense and intuition, along with the limited knowledge I had gained. And what I got at Smith was that I could speak, I could think, I could understand more about people and the feelings and attitudes they had, much more about human behavior. And I think one of the big things I learned was about myself. And that was one of the real positive factors, because you did have a chance to really look at yourself, what you could do, what your strengths were and what your weaknesses were, and then to plan your program from there.
We're resuming our discussion this morning with Miss Eleanor Bradley. Miss Bradley, when we left off, you were telling us about your time at Smith College. Where did you go when you left Smith?
Well, when I left Smith, I came back to Vancouver, to the Arthritis Society, and I stayed there until 1959, when I came to a program that was developing in the Faculty of Medicine here at UBC. And I had been invited by the director of the School of Social Work to apply for the position, which I did, and was accepted and became one of a interprofessional team of a pediatrician and the public health nurse and the social worker. And we developed a program in well child care for children of student families who were here at the university living on campus. And it became a focus of preventive medicine, as well as a teaching facility for students, medical students in pediatrics.
Mhm.
It was a dream of the Dean of the Faculty of Medicine, Dr. Jack McCreary, that this sort of approach to health care would be developed. And from there, that developed into a family practice teaching unit, because we were just treating a well child and not his, and if his family, any member of his family was ill, they went elsewhere for care. And we very quickly realized that this wasn't a way to practice even preventive medicine, that you had to look at the whole family.
Mhm.
And from there, we developed the Family Practice Teaching Unit, which is now a very active program here on campus. But I think as far as I'm concerned, those years that I had with that particular unit was trying to develop an approach to being one of a team or the interprofessional group that would offer service to people.
Mhm.
And we developed a teaching unit. We had students from the School of Social Work, Nursing, Pharmacy, Home Ec, and we also had them from Rehabilitation Medicine. And we also worked very closely with the Faculty of Education and helped develop what we was called the Child Study Center, which was a preschool experience for young children,
Mhm.
and really worked very closely with early childhood education.
Mhm. So in the course of that, the development of that and its implementation, what kinds of services would a child and a later family receive through this?
Well, for example, if a family came to the unit for health care, they would receive whatever physical care they needed. If there was a social problem or marital problems, they'd be referred to the social worker. A dietary problem, we would use, we had the availability of the students from Home Ec who would be assigned for that particular reason. If there was a child that went to the Child Study Center, here was another focus. And if there were parent-child relationships, we became part of that. And if people were having, an individual was having a problem with medication, for instance, why we were able to bring the pharmacist in who could discuss and make a part of that. And in that way, we tried to look at the whole person and what the needs were and assign the need to the appropriate professional for help.
Mhm. So the client or the patient, depending on,
Mhm.
I suppose, which profession was dealing with the person at the time, could really get the broadest range of service then, and sort of a one
That was
stop.
that was the idea. That was the whole philosophical approach to the development of this program, that we would be able to really look at the person's, decide what that person's needs were, and assign the appropriate professional.
Mhm. Was there, what kind of an educational component would be involved for the patient themselves?
Well, each discipline would try, and help them with the, for instance, in the dietary, well, that would be an educational aspect there, that the home economist would help the person with their particular needs. It was offering that service to individuals, plus the teaching of the various disciplines, so that when they left the university and went out into the community, they would know that there were other professions available. That was one of the roles of the social worker, was to acquaint other professionals with the different resources in the community that they could use.
Mm-hmm.
And we also had the doctors who were doing their specialty in family practice. And of course, this was a group that we tried to work very consistently with, so they would know what resources were in the community,
Mm-hmm.
so that when they got out into practice, they would look at the total person. I don't say we were always successful, but we really tried.
In the course of that job, did you then work with community agencies across Vancouver?
Yes, and one of the interesting things that, and the most contact I had with agencies, was a program that was developed for first-year medical students. They had a course in community medicine, and 8 students would be assigned to 2 physicians in the community, plus a community social worker or a public health nurse. And those 3 tutors would take on those 8 students. And they had the students into the community, learning about resources. And the preparation and the assignment of those students was a lot of the work that I did latterly when I was with that program.
Mm-hmm.
And again, this was not only to acquaint the students with the community resources, but we also focused on interviewing and communication skills with so that this was where they were learning really their techniques in interviewing and communication skills.
Mm-hmm. So was that your contact with the Faculty of Social Work then, was through that means?
Yes, and I did one something I didn't really feel fully equipped to do, but I did 1 year of teaching second-year casework, and there was illness, and I was asked to do that, and I was working in both faculties at that time. But I enjoyed it very much, but I didn't feel I had the qualifications, or I didn't feel that was the thing I really wanted to do, was to do it really going on a didactic lecturing or teaching in the classroom.
Mm-hmm. Practice is what you...
Practice, and I thought my skills were in teaching through the clinical situation.
Mm-hmm. Mm-hmm.
And that's what I did. And we had students from the School of Social Work. And we also, at that time, my background had been in casework, and I'd always thought, oh, group work, I never want to. I just don't have any training or skills in this. So with the help of people at the school and the lecturers who came into the community, I was able to pick up some skills, and with the really great help of Van Furness, who was here at the School of Social Work, we did some groups and these were preventive groups. For instance, with social work students, they would have, we had groups on parenting, and they would have the parents who would come, and there would be discussion groups. We had some with seniors, so we did that.
Mm-hmm.
And I think another area in which I attempted to demonstrate what social work could do was in preventive programs in the prenatal clinics we had with the public health nurse and the doctors, in meeting with the parents-to-be, and we each had our role of discussion with these parents. And then later, after the children were born, we brought the parents back with the children. The public health nurse would do the really tiny infants, because most of the questions parents would have would be in relation to feeding and this type of thing. And then we took what it meant to be a parent, what the impact had been on their lives with the addition of a member in the family. And we kept this up with right through up to children were 2 years of age. The public health nurse and I developed this, and this was a good demonstration of what social work and another profession, how you can work together.
Mm-hmm. So you'd have the continuity with a family.
That's right.
Prenatal and
Yeah.
then immediately postnatal and then all the way through.
That's
the
right.
child.
And that was one of the uniqueness about the teaching
Mm-hmm.
center. Mm-hmm.
Well, what kind of feedback did you get from the parents in that situation that you were just describing?
They were very positive, and they really wanted to come, and for any reason we had to, say, miss a week. We did this weekly. why they would be, you know, on the phone. Now, when are we going to get together again? Why do we have to miss this? Couldn't somebody else do this and so?
Mm-hmm.
And they were very responsive and found it very, very helpful.
Mm-hmm. Oh, I'm sure. I'm just thinking from my own experience how nice it would have been to have something like that to get the parenting off to a good start.
It was interesting when I finished my last session with a group of these parents. There were about 10 or 12 of them, and the children by that time were toddlers, you know, 18 months or so. And the last session we had, they took pictures of the group and of the children, and then they had a footprint of each child, you know how they do on paper, and they presented all this to me, which was really quite fun.
Oh, that would be
Yeah,
nice to
it was
have.
really quite interesting.
How long did you stay at that in that position with what became?
Well, I stayed 17 years at the university, and until they said it's time for you to leave,
It's time to retire.
time to retire.
Mhm. So when did you retire?
In 76.
I wonder if we could go back a bit then. Over the years, I wonder about your involvement with the professional association.
Well, that goes a way back when. And of course, when I joined the profession, which I did as soon as I was eligible, we were the Canadian Association of Social Workers with the Vancouver branch.
About when would that have been?
Well, that was in the 40s, mid-40s.
Yeah.
And I worked very actively there with on committees and on the executive. I think I was president one year. And I also was a member of the CASW National Board one time.
Mm-hmm. Do you have a recollection in those early years about the kinds of issues that the organization was considering?
Well, yes. We were very concerned. One thing was ethics and professional practice. And we had very active committee, and I remember we went in fear and trepidation with Miss Mary McFedrin and Zella Collins and Amy Edwards. Maybe you've heard of all these people from the past, and Elizabeth King. And those of us who were very junior at that time, you know, we felt very privileged, but at the same time, there was a fear of whether we were going to be able to measure up when we met with these people. I think one of the interesting things, one of the ethics committee, I can remember it when Zella Collins was the chairman, and the thing that we discussed was whether social workers should go to beer parlors, should be seen in beer parlors, with or without clients. You know, you might go and meet a client there, you know, for a professional contact, or you might, did you go there yourselves as professional people? Did you go to a beer parlor?
Mm-hmm.
And then did you need to wear hats when you went out interviewing? Did you wear your hat and gloves?
Mm-hmm.
And these sorts of things, they were really serious problems at that time, so you can see how things have changed through the years on that.
Mm-hmm.
Those weren't the only items or the things that we discussed about in the ethics committee, but those are just sort of little examples of some of the concerns there were and the changes that were occurring, because I think we were pretty rigid in some of those days. But the other things that I can remember that we did were in relation to welfare rates at that time. You know, doesn't that sound familiar, that today they're still doing these sorts of things of going to Victoria?
The amounts of assistance?
Assistance.
Yeah. Mm-hmm.
And I can remember one time of going to Victoria and meeting with the Minister of Social Welfare on the rates. And also, there were many changes occurring in the Juvenile Act, and we made representation on to government in relation to what was seen and briefs were prepared and taken.
One of the issues that I'd like to ask you about in particular, and I'm not sure where in the sequence of events it took place, but there was some debate, I understand, over whether or not employees of the Provincial Department of Welfare should be generalist workers or specialist workers, whether they should have specialization in child welfare, for example, or whether they should continue to carry the general load. Were you at all involved in that debate?
I can recall that there were some discussions regarding specialization and a generic approach, yes. And I don't think I was directly involved in that, that I recall.
Did you have opinions on the matter?
Oh yes, I think that basically you needed that really strong generic base, and then if you were going into, like I did, into the health field, you needed extra knowledge and specialization in that.
So
But not that you became an extreme specialist, but you had that broad base, and then whatever field you went into, whether it was child welfare or a health field or into corrections, that you needed added knowledge as to how to cope.
Were there other issues that that you recollect over the time that you were involved in the professional association?
Yes, we became very interested in establishing a professional social work in hospitals. And I was involved with a committee, a national committee that worked on standards for what we called medical social work.
Excuse me.
And there was always a division between the psychiatric social worker and the medical social worker.
Oh.
Yeah, that was another area of, when you're thinking back onto specialties, that if you were a psychiatric social worker and you were a medical social worker, there were grave differences.
Could you
Because,
describe those differences?
well, I think the medical social worker grew up in the hospital, and those early days when they said, you know, the social worker was the handmaiden of the doctor, and they felt that the psychiatric social worker had more background and more knowledge. And this was one of the things that we tried to do, was to begin to build a more professional base in social work in hospitals. And there was a national committee, and we did do, I think, quite a lot to help build up a more professional social work departments in the hospital. So now it came to the point where you thought more of a social worker in a health setting. And I'm not sure whether that still sticks or not, because you're thinking of health in the broad sense. Well, you could have emotional problems and social problems.
Yeah.
Yes.
Were you involved in when the BCASW got off to its start?
Yes, I was. And that was a time when we had many heated discussions in the association as to whether, you know, we should become a provincial association and what standards we'd have, whether they would be the same eligibility for membership as we had in CASW. And I think we got off to quite a good start there. And many, many people worked very, very hard on that.
Why was there a move to start a provincial association?
Well, I think again, I think maybe the West felt some isolation from the parent body, so to speak, and we felt we could be stronger if we came together and spoke as a province, rather than a branch here and a branch somewhere else. We didn't have that many branches in British Columbia at that time, but we had several. And I think it gives us a stronger base from which to work.
Somewhere along that time, or I guess a number of times, British Columbia has experienced a sort of a boom-bust cycle where the economy goes up and down. And and social welfare expenditures are often affected by by both. During the late 50s, there was a sort of a downturn in the economy, and I guess a fair bit of discussion in the social work community about cutbacks in social expenditures. Were you involved in that, or as a member of the association, were you involved in that?
Well, I was involved in some committees at that time, but and tried to voice an opinion and support the association, because I think they had some very sound stands and reasons why we felt that cuts were very detrimental to people, creating many hardships.
I understand that someone resigned publicly, a social worker resigned publicly over the cutbacks.
In child welfare?
I don't remember whether it's child welfare or other.
Well, there were some resignations in child welfare, and felt that I think standards were really deteriorating, and they just couldn't tolerate seeing what was happening to people, and so that's what led to resignations.
And see, this would have been in the late 50s, and you were just finishing with your arthritis.
Yes, that's right.
Were those kinds of economic upswings and downturns affecting you there?
Well, they did in relation to the money that was made available for patients to come, or individuals to come and get care. You see, they had an inpatient service, and the government paid so much a day for those individuals, and the amount was cut so that you could not have as many patients admitted for treatment. Yes, it did. And then it was more difficult when people went back to their own homes. It was almost impossible to find work for people who were limited in what they could do.
The employment opportunities
were
handicapped.
handicapped.
Yeah. You also, I understand, had some involvement with the American Association of Social Work. What were you doing there?
Well, how did it happen?
Yeah.
Well, the National Association of Social Workers developed a program called the Regional Institute Program, which was continuing education for workers in the medical field. And there hadn't been a region developed on the West Coast. And in 1957, through a professor we had here in the School of Social Work, Art Abrahamson, he made contact. He was here, and of course he came from Seattle, and he asked if I would explore to see if there were workers in British Columbia who would be interested in becoming a part of a Northwest region if we developed it. And so I did do that, and of course there was great interest because we were all wanting as much education or continuing education as possible. And from that I became involved, and then became a representative for the Pacific Northwest. And for 5 years was chairman of a national committee. I think I was the first Canadian to be chosen as a chairman of a NASW committee, which was quite exciting. And you met people from all over the country, and the content of those institutes, which were yearly, added a great deal, and the focus went from training or on continuing education for social workers in medical settings to social workers in health settings.
Again, that sort of
the broadening, that whole broadening. Yeah. So that was a very interesting experience, and one I think I, from that continuing education, gained a lot and added to the knowledge that I had, which I was able, hopefully, to convey in my practice and the work I was doing.
Since you retired, Ms. Bradley, I have the impression that you kept busy doing a lot of various kinds of volunteer activities. Have those, could you describe those as they relate to social work?
Um, well, when I retired, I was on the board of the Community Homemakers Society of Greater Vancouver, and I continued working with that group until 2 years ago. And my volunteer work at the present time is related to my connection with the Ryerson United Church. And I've been involved in programs there we have a luncheon program for senior men in the community, men who are alone for one reason or another. And I've been involved in activities such as that, and with the personnel committee with our church, and try to bring what knowledge and skills that I have had to that particular committee. And, I don't know, I live in an area which is very interesting, a new development in Vancouver, the False Creek area. We have a False Creek Community Association, and I'm involved in that as well. It's just very interesting and a very stressful time, because we're just at the point of wondering whether Expo is going to go ahead or not, when we've put a lot of effort and a lot of interest in that area, not only there, but BC and all of the world, really.
Yeah, and the decision will be made in just a few days.
That's right.
Yeah.
So I sort of keep myself busy with things like that.
I'm wondering now, I want to ask you a couple of general questions as we move toward closing. One would be about in the overall, the most significant things that you think have affected medical social work over the years.
Well, I think it's been that the social workers have really worked very, very hard to bring the professional aspect into the practice that was developed and ongoing in hospitals. I think as we gained more knowledge about people and the relationship between the physical and the social and the emotional and spiritual well-being of people, that people have been persistent, they've demonstrated good practice, and I think other professions too have become much more aware of different aspects of human behavior, and I think as the whole knowledge that we've grown through the years in relation to understanding people, that this is all added and made it possible for a better service to be provided, and a more recognition of the social work profession of what we can do.
Excuse me. Again, another general question, if I might. As you think back over the years that you've been in professional social work practice, I'm wondering if there are accomplishments about which you're particularly pleased.
That I am? Well, now that's an interesting question. I think the things that, well, first of all, in child welfare, I was very pleased or felt great satisfaction from the adoptions in the work I did there. I think having students from the School of Social Work and learning from students, I think this is a challenge, and it all through the various settings in which I worked. The students contributed a great deal to my growth and to a challenge to me, and I feel satisfaction today when I see where many of these students are. Some of them at the teaching now in the School of Social Work, some of them very key people in community agencies. This is a great satisfaction. And I think the contributions I've tried to make to the CASW, and then also the contact with NASW, and trying to remind them that I was a foreigner and that there was Canada, and tried to develop those were great satisfactions.
Mhm.
I think working here at the university was, and the development of the programs, I'm not so sure that they're, have reached what we had hoped they would in relation to a multidiscipline approach. I think as each faculty has grown and grown, I think in other ways they are coming together, maybe different than we had envisioned in those earlier days.
Mhm.
I think again it depends a lot on the individuals and what their background and but I think there's a satisfaction in seeing that they're looking more at the whole person now
Mhm.
than maybe just sort of trying to put people into categories.
Yeah, and you definitely had a role. Well, you definitely
Well, I
played a
hope
part
I
in that.
did. I hope I
Mhm.
did. I gained satisfaction, and I say with humility, I hope I made a contribution in that, in those fields.
I'm wondering if I could ask you what it has meant to you to be a professional social worker.
Well, it's been my life, and I was never sorry that I left nursing. I feel that what I gained there, the knowledge and the experience I had, I've been able to use objectively in social work, and I still keep a contact with the girls I trained with, and we keep an alumni association, which we have certain projects we have had through the years. Now that training school has closed, but we still keep together.
Mhm.
So that did have an impact, but I think professional social work was my life, it was my career. I never married. And I met very good friends, long-lasting professional and personal friends out of the association I've had.
Mhm.
And I hope I've made a contribution to the clients, and that they didn't suffer too much from some of the things that we did, with some of the practice that we had made available to us.
Uh-huh, uh-huh. I wonder if in closing there's other topics that you'd like to talk about.
Well, I don't know any more than I think the people, the professional people I met through the years in my social work training, like the people here in Vancouver, those early people I mentioned, the Mary McFedrins of this world, Zella Collins, and of course we all remember Dr. Topping in our different ways. And I think the thing that one of the impacts on me was the experience I had and the learning I gained from Smith College, where we had such people, outstanding people as Florence Day, and I was one of the fortunate people that had Annette Garrett for casework. I can say that now. It was in fear and trepidation, but we had Annette Garrett.
No, I've not heard of her. Was she a formidable person?
You mean you haven't heard about Annette Garrett?
No.
Your education has not been completed.
Well, tell me about her.
Well, she, I think, was one of the most outstanding people in the social work field and training. And she made it her, I don't think she really meant to be, but everyone was just in fear of Annette Garrett. And I can always remember when we went, she told us where our placements would, or she asked us, first of all, what we'd like in placement. And I had my first summer at Smith, and as I said earlier, I wanted to have that placement in a setting where I have psychosomatic medicine and psychiatric consultation. So I told her this, she asked me, and so she just turned to me and she said, what you need is a placement in a good family agency. So I thought, well, I've blown it. So when the placements were listed, where did I get a placement? At the Massachusetts General Hospital. So, you know, this was the sort of thing, you never knew where you stood with her, but she was an excellent teacher, and you learned from her. And so she was one of the highlights of my education.
Okay, anything else you'd like to add?
I don't think so, except it's been, I've enjoyed meeting you, and thank you for inviting me to be part of the project. And I think we thank Mary Hill from the School of Social Work, who has been working very closely with you, and I'm sure finding the people in BC who would be interviewed. And that has been, I think, very grateful to you to be doing a history such as this.
Well,
And I hope it'll be useful to a lot of other people, and for students to see that there has been a past in social work.
well, I want to thank you very much for participating this morning and for coming out so early.
Thank you.
And to tell you how much I enjoyed it. It's very educational for me.
Thank you.
About British Columbia as well as about Annette Garrett.
Thank you.
Thanks.